is important. We all should know your care planning, hypovolemia deficit, hypervolemia overflowing of the body. I'm going to go on diabetes insipidus. And diabetes insipidus is important to know and highlight the word on diabetes insipidus, decreasing ADH. And where do we get the ADH? Write down pituitary gland. What part of pituitary gland is posterior pituitary gland? And what happened to the patient with your patient when they have diabetes insipidus? So everyone, posterior pituitary gland, and what is low here is ADH. Remember, what is ADH does? Everyone should know, affects on the kidney. And what is kidney does? Filter the urine. And what happens when you don't have ADH? And after kidneys filter the urine, ADH absorb back and it maintains our fluid balance. Now, if you don't have ADH, what will happen? Your ADH is missing, kidney will just filter more urine and we are not absorbing back. So what is the problem with patient in diabetes insipidus? Everyone remember, your pituitary gland is in the brain. Anything goes wrong in head injury or your patient has a pituitary problem, diabetes insipidus, it says excessive urine output. So remember the word polyuria, polydipsia, and that means the urine output is more. And drinking water. Can you give fluids? Yes, they're losing more fluid. And if they ask you, what do you tell your CNA? Let her give more water because patient needs more water. Now remember, when you are having a lot of urine output, you are feeling thirsty. Number 2, you remember dehydration. And what happens when you are dehydrated? Very important is number 3. I want you is remember when you are dehydrated, you have hypotension. Your blood pressure is low. Your weight is low. And what else you are losing here is your specific gravity is low. I want everyone to add here in your notes, sodium is high. And when you have high sodium, what is the word is called? Hypernatremia. Everyone should know hypernatremia is very important in your electrolytes in NCLEX is important. Hypernatremia, remember one thing, you give fluid. Are we clear? And which patient you have when you're losing more fluid. And what would be the patient is, only one thing is high. Remember the word dehydration. Remember the word blood pressure is low and specific gravity would be low. And what medication do you give them? Number 4, it says pitracin. Pitracin is your medication. DDAVP. Sometimes they use the word DDAVP. Pitracin medication. What does it do? It reabsorbs more fluid. Are we clear? So if they give you, doctor has ordered pitracin. How do you give pitracin? They can give IM, they can give nasal. And when do you give? When patient pees more. Are we clear? PRN means when they pee more, or patient say, I'm drinking more water. Means that they're peeing more and they're drinking. So they use this word, polyuria, polydipsia. How do you know your pitracin is working? Patient says, PRN, when patient drink more water, or pee more, you give PRN. How do you give them? Nasal. When you are giving nasal, alternate nasal, because it causes irritation in your question. What do you monitor patient with? Patient who has diabetes insipidus, remember, is they're dehydrated, one word, everyone remember, and sodium level is high. Another question on your electrolytes. Patient has hypernatremia, remember the word dehydration, remember the word you give fluid. And what you monitor for patient for diabetes insipidus are they pee more and they want the medication to cut down their urine output and they're reabsorbing the fluid. And also number 5 is give them IV fluids. Are we clear? Increase fluids, give the medication to hold the fluid. So what is diabetes insipidus is polyuria, polydipsia, pitracin, important word, sodium is important in electrolytes. And these are very important for your patient with diabetes insipidus. Now, next is SID, is opposite. What is SID is opposite to diabetes insipidus. Now, I will write it down for SID. Now, SID means is they have too much syndrome of inappropriate antidiuretic hormone. First thing we remember, they have too much of ADH. What is they have here? Too much of ADH. So what is ADH is doing? Reabsorbing the urine back. So what do you have in your body? You will pee less. And what do you have in your body is over fluid. Diabetes insipidus, you have dehydration. SIDS, you have over fluid. Remember that word. Low urine output. Patient has very low urine output. What does it cause here is called the word edema. I want definitely everyone simply remember the word. Patient will have low urine output and patient has edema. And what is edema is causing cerebral edema. What happened in cerebral edema? Write down the word ICP, level of consciousness. Are we clear? So some questions are, what do you monitor for patient with syndrome of antidiuretic hormones? Remember the word, they are retaining fluid. And when you retain fluid, your body has more fluid. What do we lead into is water intoxication. So I want you to write down the word water intoxication. And water intoxication question, what are you monitoring? ICP. Are we clear? Now, next thing you remember, when they have edema, what does it cause? Their weight is increasing, their blood pressure is increasing, and specific gravity is increasing. And their sodium level is low. So when there is a question, patient has hyponatremia, what are you going to do? Are you going to give fluids here? No, they're already retaining fluid. So everyone, two things we remember. SID question, they have too much of ADH. When you have too much of ADH, it keeps the water in the body. And when you have water in the body, is leading the word edema, leading the word water intoxication. What does the patient has here? Is they're gaining weight, the blood pressure is high, and also specific gravity. When your urine is less, the gravity of the urine is higher. And what would be next thing is here, don't give fluid. Are you going to give fluid to patient who is sick? Number 1 answers every one question, monitor ICP, monitor level of consciousness. What do you cut down? Restrict fluid. Number 1, your answer. And what do you give? Number 2, diuretics. Everyone, we are going to give diuretics. What are we monitoring here? Level of consciousness. What medication do you give? You have daclomycin. What is daclomycin is? Help them is to decrease more fluid from the body and doing the word of what is cutting down the body fluid. It's more working as for ADH. So syndrome of is very important. Antidiuretic hormone is called S means syndrome, I means inappropriate, antidiuretic hormone. Everyone is okay to condition? DI and SID. DI, what patient has? Polyuria. And sodium level is high. You can give fluid. What happened in SID is ADH is more and they are retaining fluid. And what are you monitoring your patient here? Is water intoxication. What are we monitoring here? Level of consciousness? See, straight question. And what do you cut down here? Fluid. What medication are you giving? Diuretics. What medication do you give? Declomycin. So make sure we memorize. Start writing your drugs and start memorizing. Before I move here, I gave this package. Everyone make sure you guys have this package. And I want you to highlight few things and rest you read it. Very important for your pH is, and if you don't have, here I have few more packages. Okay. So we need these packages, everyone, and we do have signing out sheet. If anyone is leaving, make sure that we put it on the side. Make sure we all sign in. And this package is, I want to show you, is acid base, very important. And I do in respiratory package also, but you'll have few things here. Remember, in acid base balance, there is a word Rome. In the Rome word is respiratory is opposite. What is opposite in respiratory? You're looking, underlined second word, by PCO2. In respiratory, what are you monitoring? PCO2 is bicarbonate. Everyone is okay? CO2 is your carbon dioxide. So in respiratory, alkalosis is pH is up, but CO2 is down. That means opposite. Now acidosis, when you have pH is down and CO2 is high. So alkalosis, you have low sodium. What is the normal sodium is CO2. Normal pH is 7.35 to 7.45. Then CO2 you have 35 to 45, and bicarbonate you have 22 to 27. Make sure you guys can write down. But remember, in acidosis, in in respiratory, whether it's alkalosis, acidosis, pH and CO2 is opposite. Are we clear? In alkalosis, look at the second word is equal. If your pH is high, your bicarbonate is high. And HCO3 is in your metabolic is on there or equal, whether you are on alkalosis or acidosis. Are we clear? And so make sure you guys know and you can look in that. Next page, everyone go very simple. All your alkaloses are, your pH is up, whether it's a respiratory or metabolic. All alkaloses, what do you have? Your pH is up. And acidosis, your pH is down. So that's a good way to memorize. Then you go on third page, which patient you have alkalosis. And alkalosis comes from hyperventilation. So when they're saying patient has respiratory alkalosis, means is what? Hyperventilation. Which patient on the next page, third page, where you have alkalosis word? Everyone is okay? Do you guys have the same package? On the third page, you guys have causes of alkalosis, hyperventilation. Now, which patient hyperventilation? That's a respiratory alkalosis. Hyperventilate, underline the word, pulmonary embolism. Hyper is ventilation, anxiety, hypoxia, fever, and that means your patient with is alkalosis. Then you're going in metabolic alkalosis is your Ng2. You have over acid, anti-acid. Diuretics, you will have alkalosis. That's metabolic. Where it says hyperventilating, that's respiratory. Underneath, that is your metabolic alkalosis. So look on that. And next page, you will move on. You have acidosis, means respiratory. Next page, respiratory acidosis is you have what? Hypoventilation. And next one, you have ketoacidosis patient. They're going in metabolic acidosis. So next page is all your acidosis, respiratory and metabolic. Now that's a good way if you guys look through on that. So I gave you some pictures. And next page, if you move on where you have picture, remember all when potassium is high is affecting the heart. you've got to monitor EKG. So heart is affected. Dysarrhythmia word. Diarrhea. Whenever you have more potassium, your patient is having diarrhea and your patient is having dysarrhythmia. And when we have acidosis and your potassium acidosis, your potassium is high. All your acidosis, you have potassium level is high. And that's why you have acidosis. Next page, potassium deficit. When you have low potassium, patient is nausea, intestinal mobility, nausea and vomiting, paralytic ileus. That means low bowel sound. Low potassium, low bowel sound. High potassium, diarrhea. High potassium, patient has cardiac problem. Next page, I gave you guys lab. Everyone start knowing your lab. If you have your page, that's good. Then some other pages I attach for vitamins. And the next few pages you have diet and all kinds of answers on your diet you can look. And there's a last page you guys have also for some labs. So these extra pages I gave you and the kinds of diet. As I move in, I'll keep this along with you. And when I'll tell you, and maybe highlight that word, but very important. These are for your NCLEX to know some of your acidosis question, alkalosis, potassium, what do you monitor? So let me go back on Spiderman package on page 4. We talked about diabetes insipidus, SID. What gland of these two diseases are? Pituitary gland. Now, what do you monitor for SID? What do we monitor for SID here? Is level of consciousness. Why? Because they are retaining fluid. And everyone should know your sodium level and what is the normal sodium level, because it's affect the body fluid. Your sodium level is important. Hyponatremia is very bad. Hyponatremia is in SID patients are and don't give fluid. Remember that for your electrolytes. Now I will move on. Potassium. Potassium is important for our cardiac problem and patient for your diet. And what is a normal potassium level? We gave in the pages you guys have 3.5 to 5.5 and potassium is important. Now let's go low potassium. Patient has hypokalemia. What do you monitor for hypokalemia? Underline the word dysarrhythmia. And muscle weakness, or write down the word muscle cramping. When you have low potassium, can lead to muscle cramping and affecting also abnormal heartbeat. And potassium, you give food. Remember, your diet is very important. And what food do we have here? Raisins, bananas, apricots, beans, potatoes. You can add there also strawberries. And which patient has low potassium? Which patient has low potassium? I want you to write down the word Cushing. Everyone in your endocrine system, Cushing has low potassium. And write down the word, when do you lose potassium? Suction, gastric suction. Vomiting, you lose also sodium and potassium. And when you're giving what? Diuretics, what do you lose? Potassium. Everyone right away in your endocrine glands are, I said is, you can add there for low potassium, Cushing. Gastric suction, vomiting, you lose potassium. Diarrhea also, you lose potassium. When you have low potassium, patient has cramping, dysarrhythmia, you give potassium. Before you give potassium, what do you monitor? So remember your question. Last word for potassium is K. If they give you KCl, 20 MEQ, doctor has ordered, that means KCl means is potassium. So wherever you see in your question KCl and potassium, potassium is marked with K. And what do you monitor before you give potassium in your question are, number 1, write down kidneys in your question. Which patient, because you're going to increase potassium level. Renal failure patient, don't give potassium. Renal failure patient has what? Low urine output and potassium level is high. Now they're asking your knowledge. Before you give potassium, what do you monitor your patient? Renal. Remember the word is you pee more, you lose potassium. No pee, potassium level is high. And we talked in the first pages. So remember, no pee, write down the word when you are not peeing. Your potassium level is high. Another question they will give you. See, there's no straight question that we know, but we connect it here. Now you have low potassium, doctor has ordered to give potassium. What do you do as a nurse before you give potassium? Check their urine output. If patient don't pee, a patient, or there is a question, patient has renal failure and doctor has ordered potassium. Are you going to question that? Yes, because you can give potassium. They're already having high potassium. Everyone is okay? No pee, no potassium. You pee more, you lose potassium. Another question. Doctor has ordered you look lab. And everyone should know the level is of kidneys, BUN, and creatinine. If your creatinine level is high, are you going to give potassium? No. So remember that. IV straight potassium, IV push. What is the meaning push? You are taking in a syringe and you are pushing. You cannot give IV push. Your potassium should be mixed with the normal saline and giving with what? Small bags. Mixed it with other thing, but no straight potassium because heart can be affected. Everyone is okay? So hypokalemia. Hyperkalemia means murder word. Too much of potassium, it says murder. M means muscle weakness. U means is oliguria. Whenever you have oliguria, your potassium is going to be high. Anuria. Patient has anuria. What are you monitoring? Potassium level. Why? Because when you don't pee, your potassium level is going to be high. So U means is what? Mu is oliguria. Then you have D. What is D? Respiratory depression. And then you have E. E means second line ECG. You got to check the cardiac. R means reflexes. It may not be causing is any reflexes. Now patient who is having too much of potassium, lot of your kidney problem patient. Who else is having more potassium? R. In underline the word Addison disease. Addison disease, what do you have? More potassium. Cushing you have low potassium. Addison disease, you have high potassium. So patient with renal failure, what are you monitoring? Potassium level. So remember, two things, hyperkalemia is bad. Remember, potassium is high. Before you give any patient potassium, check the kidney. Hyponatremia, we already talked about it. What is hyponatremia? I want you to underline the word increased ICP. Why? And which patient hyponatremia? Write down the word SID, S-I-A-D-H. And also highlight the word convulsion. What does it mean? They have cerebral edema. What medication do you give? Mannitol. Write down here, hyponatremia, ICP is high. And write down on the side, when you have hyponatremia, your sodium level is low. You are monitoring convulsion and do not give fluid. So hyponatremia, everyone should know you're monitoring convulsion. Why? Because they have too much of fluid. Write down the word restrict fluid. So what are you monitoring patient for hyponatremia? Everyone should know seizure, and everyone should know the word cerebral edema. Which patient you have is hyponatremia sick. Why in sick? Because they are retaining fluid. Hyponatremia or underline the word hypotension and increasing temperature. Write down the word dehydration. What does the patient has here? Dehydration. Which patient you have hyponatremia is, write down the word diabetes insipidus. Everyone should know. If you need the packages are here. And if you have it, that's good. So everyone, hypernatremia, hyponatremia, you must know. So which patient has hypernatremia? Diabetes insipidus. Don't give them the fluid, restrict the fluid. Now, hypocalcemia, we already talked about, low calcium. Remember the word CAT's word. A hypercalcemia, we already talked about R. Underline the word, when you have too much of calcium, underline the word absent deep tendon reflexes. Hypercalcemia also causing what? Abdominal pain. What did I say? Hypercalcemia is renal stone. Remember, write down the word renal stone and fracture. Magnesium, very important. Low magnesium, underline the word tetany. When you have low calcium, you get tetany. When you have low magnesium, you get tetany. And dysarrhythmia. Dysphagia, same as calcium. So remember, calcium, magnesium affecting muscle. Hypermagnesium is causing also too much of magnesium, absent deep tendon reflexes. Remember, you give to the mothers magnesium sulfate in pregnancy, and what do we monitor? DTR. If you have too much of magnesium, what does it cause here? Absent deep tendon reflexes. And also respiration. It's an emergency. And for when you're giving too much of magnesium. Addison patients are, I will move on a little bit, Addison and Cushing and adrenal crisis, three of them are disorder of adrenal gland. So everyone, I will cover adrenal gland now, and everyone should know adrenal gland as Addison and adrenal gland too much of Cushing, and also they go in adrenal crisis. So let me finish Addison disease. So I want quickly, everyone, when I'm saying write down few words, remember. Addison disease is a disease of adrenal gland, number one. What is adrenal gland? How many adrenal glands? We have two. And where are adrenal glands? On the top of the kidneys. And what is adrenal gland is producing, remember the word your steroid, but everyone should know the word glucocorticoid and mineral corticoid. Very important. So what is Addison disease are low steroids. Number one, some question they will say low is called cortisol. Cortisol word is for steroid. So what is low here? Low steroid. Now when they say word steroids, you will know. And what is low here? Cortisol. What is low here? Glucocorticoid and mineral corticoid. Now when you don't have steroids, number one, what is the problem with the patient? They have low sodium. Write down like that. You guys have some of the things there is written. Hyposodium, they wrote the word Na. Hyper K, hypoglycemia. But write down like that on the top, low sodium. And what is low? Sugar. What is low here? Blood pressure. What is high here? Potassium. What is high here? Calcium. So what is low here? Everyone should know they have no steroids in the body. What is the body is missing is sodium, sugar, and their blood pressure is low. Another thing, page number 4, and on page number 4, Addison disease, and I want you to write down the word, they're losing weight. In your question, what are they losing weight are, patients are losing weight, and they have low steroid, and they have low sodium, low sugar, and low blood pressure. What is the skin is? Pigmented skin, or maybe a brown skin. Bronze skin, bronze, B-R-O-N-Z-E-D, and pigmented. These are your questions. Mostly your questions are going to be, what is Addison disease? Adrenal, and what part of adrenal gland? I want you to remember cortex. There are two parts of the adrenal gland, cortex and medulla. Now, cortex is the adrenal gland, and they are low of steroids, are low of cortisol. What is low here is sodium. What is low here? Sugar. What is low here? Blood pressure. What is the skin is here? Pigmented and bronze skin. What is high here? Potassium. Remember, right away, which patient has high potassium? I told you to write down the word is in your Addison patient. How do you treat them? What drugs are we going to give? I want you to write down the word. The drugs are, maybe they're saying word mineral corticoid. So write down mineral corticoid are your steroids. And next medication is called Florinef. Florinef. F-L-O-R-I-N-E-F. Florinef. So what drug are you going to give? You are giving them steroids. Are we clear? And what is the other name of the drug is called Florinef. So those two drugs, you will see any books I came across question, those are to answer. So what is Addison diseases? Everyone, they're missing sodium. What happened in summer? We sweat. What will patient would lose more? Sodium. You got to increase sodium in the diet. And they will ask you, patient is craving for what? Sodium. What do you give them? Sugar. What do you check? Their blood pressure. You're admitting a patient who has Addison. What do you keep in the room? Blood pressure cuff. Why? Because we are nurses. We got to monitor the blood pressure. They're dropping the blood pressure. When patient's blood pressure is low and potassium is high, it's very serious. Everyone remember two things. Just like I said, adrenal gland is maintaining for all of us our blood pressure. So what is your blood pressure is vital sign. So remember, any question, Cushing, Addison, whatever I'm talking, your adrenal gland is maintaining your blood pressure, or your answer is going to be vital sign. Second thing is electrolytes. What electrolytes is maintaining? Your sodium, your potassium, your calcium. So if your adrenal gland is a problem, or you are monitoring a patient with adrenal gland, immediately you know your question would be, what do you monitor as a nurse? You look their vital sign and you monitor electrolytes. Are we clear? So what electrolytes are here are potassium level is very high, sodium is low. And what would be the patient is craving here? Salt. How do you treat them? I already said, by giving mineral corticoid, and we are giving Florinef. What do you teach your patient who is taking this medication, or you are admitting? We are nurses. Half of your questions are going to be patient teaching. What do you teach this patient? Number one, avoid stress. If they have stress, or they become sick, or they stop medication, so what do you teach them? These are steroids. What do you teach for steroids? Don't stop your medication, right? All of a sudden, don't stop your medication all of a sudden. If they are stopping, a patient stop taking medication and patient is going in a stress, what does the patient is going? Under Addison crisis. So make sure you make arrow, Addison you have in your package, and lower make a arrow with Addison crisis. So which patient are going in Addison crisis? Addison, your adrenal gland. When they stop taking medication or steroids, what happened in your another question? They're saying patient is taking glucocorticoid. Patients stop taking glucocorticoid or mineral corticoid. What do you monitor your patient? Patient is going into what? A crisis. What is crisis here? Same thing. Their blood pressure would be low and potassium will go high. So remember, patient blood pressure is dropping is not good. They're in bad condition. So what do? Let's highlight in Addison crisis. And let's go on Addison crisis. Highlight the word confusion, abdominal pain. I want you to add their adrenal crisis. Their blood pressure is low, potassium is high, sodium is low, and sugar is low. Very important that you know their blood pressure is dropping and potassium level is going very high. So what is Addison patients are? Potassium is high. And what would happen to them? Abdominal pain. And also hypoglycemia. add there is patient would have what here? With hypoglycemia, they have, and patient would be having low salt but very high potassium. How do you treat your patient with Addison crisis? I want you to write down in Addison crisis, you're going to give IV, no PO medication. They're in shock, you're giving IV steroids. Make sure you add there. IV dextrose, sugar, dextrose or glucose, what is sugar? You are giving IV normal saline and monitor your patient for shock and maintain their blood pressure. Are we clear? So you are maintaining their blood pressure. You are reducing their potassium level, which is very high. You've got to give a steroids patient is in crisis. So everyone, and when you are giving a steroids, then patient who's taking a steroid, I will talk in more Cushing. Addison patient, you're giving steroids, you give too much steroid, they can turn into Cushing. And I will talk about Cushing. Everyone is okay? Addison questions are low cortisol word, very important. Make sure you write down the word. How do you treat them? By giving mineral corticoid and Florinef. How does their skin looks? Is more brown skin. What do you teach your patient? Prevent stress. Make sure you take your medication, and also they're craving for salt, give them salt. Now I will move on Cushing. So you guys will be covered on Cushing, but memorize like that. What is your Addison gland is producing? A steroid. What is your Addison disease is low steroids. Now I will go on Cushing. Write down Cushing adrenal gland, adrenal cortex, and they have too much of a steroid. Cushing patient has too much of steroids. They have more sodium, more sugar. Write down like that. The blood pressure is high. What is low here? Potassium. What is low here? Calcium. Now they have more steroids. We are not giving steroid, but what are we monitoring? Number one, before we do surgery, if the questions are, number one, everyone should know Cushing patients are risk for infection. Everyone, when you're giving any question with steroid, you prevent your patient from infection. Number two, what do you monitor patient who's Cushing or you're giving steroids? Hyperglycemia. Write down the word hyperglycemia. Now your question can be, you're giving insulin, increasing insulin, check blood sugar. Patient is saying, I'm taking a steroids, or Cushing patients are, they will have hyperglycemia. You've got to monitor their blood sugar. You have to give them insulin. Number three is very important, calcium is very low. Low calcium is risk for your fracture. Monitor patient, prevent them, or your patient who are taking steroid, the risk for fractures. All your questions are going to be. And number four, I want you to write down is risk for bleeding. So what are you monitoring? GI bleeding. You are monitoring bruising. Number five, poor wound healing. Their wound healing process. Any question? Clean the wound carefully. Remove the tape carefully if they had surgery. Why? Because if you open more skin, the healing process is very bad. Either they will give you a question, what do you prevent them? Also, a skin breakdown. Remember, you put them on A-grade mattress or special mattress. Number seven, remember how does Cushing patient are? Moon face, buffalo hump. That means their clothes should be loose clothing because the way their body, upper part bigger, legs are skinnier. Clothing, loose clothing. And another question, what would be another treatment to treat Cushing patient? All your endocrine system. When you have more steroid, they got to remove the gland. What gland are they going to remove? Is called adrenalectomy. Are we clear? adrenalectomy, or they can remove your pituitary gland, because pituitary gland is your master gland which is producing more hormones indirectly. Pituitary gland is your master gland. Lot of question would be, when you're removing pituitary gland, what do you monitor? Your steroids of your body. Are we clear? So to treat Cushing patient is, number one, lower their blood pressure. So what drugs, that is a surgical treatment. In your drugs, blood pressure medication, calcium channel blocker, beta blockers they can give. Number two, diuretics. In diuretics, remember, potassium is low. Is potassium sparing diuretics? What is your potassium sparing diuretics is? Aldactone. Write down that word, aldactone. So you are giving aldactone, potassium sparing diuretics they will need. In diet question, what do you cut down diet? Remember, you have more sodium. You cut down sodium, cut down sugar. Increase potassium, increase calcium. So sugar and sodium you will cut down because they are having a lot of sodium and sugar. Yes, you can give a lot of potassium and you monitor your patient from fracture. So remember how your questions are. All your patients who are taking a steroid, you monitor them, they're turning into Cushing. Cushing patients are risk for infection. What isolation do you put? Cushing patients are reverse isolation. So that covers your Cushing. Addison crisis we done. Last one, phenochromoscytoma. That's also your adrenal gland. And this question is important. All your glands are important. One little question, but you got to connect. Where is phenochromoscytoma? I want you to write down is adrenal, is medulla. This one, cortex disease. Now you have is adrenal gland, medulla, and write down it's a tumor in adrenal medulla. And what is it producing here is more epinephrine, but is called is catecholamine. Now let's see if you guys have, it says epinephrine. And I would ask you to write down the word catecholamine, tumor, producing tumor catecholamine. And tumor, when they are producing too much of catecholamine, is affecting epinephrine. Norepinephrine, epinephrine increasing blood pressure. So remember, Cushing has high blood pressure, Addison has low blood pressure, and phenochromoscytoma has high blood pressure. So remember, all your adrenal gland, what are you monitoring your patient's blood pressure? And what do you monitor in there? Underline the word is hypertension. Second line, it also, because it's adrenal gland, sugar and sodium is affected, but very important, everyone mind, when you see question, you are admitting a patient who has phenochromoscytoma, what room are you going to give them? What room are you going to give them? Remember, blood pressure. When does the blood pressure goes up? When you have more stimulation. What kind of room are we going to give here? Non-stimulating, quieter room. Why? A stimulation causes what? Hypertension. And what else may be? Hypertension. What are the other reasons you control? How do you control the blood pressure? Yes, one, blood pressure. But what are the reasons your blood pressure can go up? Stress, anxiety, pain. Give the pain medication. Give relaxation medication. Are we clear? See how your questions are not straight. You have to think. And we got to think very importantly, not only giving a medication, but you are giving a quiet environment. Keeping the patient from pain-free, maybe answer, relieve pain. If they have any pain, relieve pain. And anti-anxiety medication. Sedatives, you can give them. Are we clear? Why? You keep them calm. Now what will happen with hypertension, they will ask you, is pounding headache, a stress you avoid. And also, is any rest break in between is good, and surgery, I already said you're removing the adrenal gland because there's a tumor. For Cushing patient and phenochromocystoma, what are we removing here? Adrenalectomy. That is a surgery because there's a tumor, they got to remove the adrenal gland. Everyone should know is phenochromocystoma patient, you are reducing blood pressure. Make sure write down and memorize quiet environment, pain medication, sedation you give them, monitor blood pressure. Now, if they ask you what can be the complication for hypertension? Now, what are the complications if patient's blood pressure and their blood pressure is very high? What does it cause hypertension? Is a stroke number one, CVA, and what else will it cause with hypertension? Your heart is damaged, and your heart is failing, CHF. When your heart is failing, what would happen for your patient? They're going in a cardiac arrest. And what happened in CHF? You are retaining fluid. They didn't give you any other question. They said patient has hypertension. What do you monitor your patient? Is fluid retention. What would be fluid if the heart is bad? CHF. What would be congested? Lungs. Here, patient will go in stroke. Keep those in mind. Kidneys can damage, and they can go into renal failure. So remember, this is bad phenochromocystoma. So we already talked about 3-4 things here. Addison, we should know, your endocrine system, adrenal gland. Addison and Cushing, Addison crisis, what goes when patient is going into crisis. Then phenochromocystoma word is what? Tumor. Where is the tumor? In adrenal gland medulla. And what is tumor is producing? What is tumor is producing? Is catecholamine. And what is it affecting here? Is epinephrine. What is epinephrine does? Increasing blood pressure. So we are covered. In the last line, you guys have neuroleptic disorder. Now, that goes in a drug question for antipsychotic medication. Write down there, side effect of your antipsychotic medication in mental health. And those who have done with me, I gave you the packages. But if you haven't done and you're going for your exam, is antipsychotic medication. You're giving for mental health patient, maybe Haldol, maybe Thorazine, maybe prolaxin, whatever drug. What do you monitor your patient when you're giving antipsychotic medication? It's called, this is a bad side effect, is called neuroleptic malignant syndrome. Now, if they give you, patient is antipsychotic medication taking, and patient has neuroleptic syndrome. So what are the signs are here is, I want you to underline the word, third line, hyperpyrexia. The meaning is they have high fever. So write down temperature, and they become stiff. Second line. Third line, they're sweating. And the fourth line is fluctuating the vital sign. So everyone should know, and patients start drooling. So when we are giving antipsychotic medication, everyone should know a stiff word. They become stiff. I will talk about another at the same time. Because very important, your drug side effect are. What do you monitor patient here is when you're giving antipsychotic medication, neuroleptic malignant syndrome. What are the signs of neuroleptic malignant syndrome? The fever is high. Blood pressure is fluctuating. Patient becomes stiff. Patient is drooling. They may not give you or asking you. They will say patient is taking Haldol and patient is having high fever. Patient is stiff. Patient is drooling. What would you do as a nurse? I want you to write down on the side the intervention. What do you do? Number one, stop the medication. That's your first answer. Don't pick up answer to call the doctor and continue medication. First thing you know it's a bad side effect, don't give the medication. Number two is increase fluid, reduce temperature, that's important, and also is maintaining blood pressure. And then you notify. So first thing is what? Stop medication. Fluid is good in lowering the patient's temperature. That is very important. Everyone should know, patient is on psychotic medication. I would ask you to write down one more symptom, and as you memorize together, one is called neuroleptic malignant syndrome. That means you don't give medication. Number two, patient has EPS, extrapyramidal symptom. That also is bad, extrapyramidal symptom. Patient becomes stiff, and patient start involuntary movement. Third word, I want you to write down the word tardive dyskinesia. Tardive, it's same like EPS, tardive dyskinesia word, same, involuntary movement. So they are shaking like Parkinson patients. Are we clear? And some word in exam, they will say patient becomes stiff and they are drooling. Patient becomes stiff, they are drooling, side effect of your psychotic medication. The wording, what are the three wording is important here is number one, neuroleptic malignant syndrome. What do? Stop medication. They have high fever, they're drooling. And number two side effect, EPS. Number third side effect is tardive dyskinesia. What is tardive dyskinesia? They're shaking and they become stiff. They are drooling. How do you stop this side effect are? I want you to write down the medication. What medication they give to stop EPS and tardive dyskinesia? Cogentin. Cogentin is a drug for giving EPS and also Parkinson medication. Now, what is Cogentin is a drug for Parkinson, as well as the doctor give two drugs together to stop the side effect of the medication. What is that side effect of the medication? Here are extrapyramidal symptom. Number second drug, you can give Benadryl. Benadryl, and third is Artane. A-R-T-A-N-E. Artane and Cogentin are the drug for EPS and the drug for Parkinson patients. Are we clear? I want you to put together. If you read one here, you don't know where we are reading. So when you're giving Haldol or psychotic medication, what are the side effects of your patient are? You have on this page is neuroleptic malignant disorders. What is neuroleptic malignant disorder? Patient is shaking. Are we clear? Now what are the other side effect I said? EPS, extrapyramidal symptom. What is the third word I said? Tardive dyskinesia. What are the drugs you are giving to stop this and this? Here are Cogentin, Benadryl, and Artane. And I said Cogentin and Artane are the drugs for your patient with Parkinson. So we covered on this page with some of the drug side effects. Let's go on page number 5. It says, I kept forgetting, but go on first line at the end, measles or German measles are you're giving is medication for German measles, rubella vaccine. What vaccine do we give? Rubella. Underline the word rubella. Second line, patient has German measles. What do we give? Rubella vaccine. What do you teach mother? Not to get pregnant for 3 months. That's important, not to get pregnant for 3 months, or using contraceptive and to prevent the side effect. Next, I'm going to move on. Regular insulin. We all know what insulin do you draw first? Regular. If you're putting air, then you go on cloudy, then regular, then you draw regular, then you draw is cloudy insulin. How long do you use the insulin once you open? 30 days. Where do you keep your insulins are? Once you open, you can leave them in the room temperature. You can leave it on room temperature, but the problem are we are getting a lot of insulin, maybe 10, 11 for one patient, because they are cheaper, so they send you the unopened vial, you keep them in the fridge. Once you open, and remember, not only insulin, any question, multiple dose. The meaning one vial has more doses. And you must put, what is your responsibility when you open multiple vial are to date it. And why? So you don't use more than 30 days. Are we clear? No dates are there. You don't know, you may not be able to use them, but it's best to put those, your insulin. So that few things we have said. Number 4, on the same package, tetralogy of Fallot's are is, what do you do for babies who are born tetralogy of Fallot? I want you, there are defects are there. It says defect, septal defect. Septal defect are, what is septal means are, your heart is divided by septum. Like atrium, you have right and left. If you don't have septum and they're not close, the blood is mixing. So septal defect means is what? In the heart, the septum, these are 4 chambers, and this is a septum. If you have opening and opening here, the blood is mixed. And that's what usually happens when the children, if they have opening, that means the blood is mixing. And what kind of the babies we call them are, I want you to write down one word, cyanotic babies. The blue babies are. So they're saying babies are born cyanotic. What does it mean? They have congenital heart problem. So one side effect is cyanosis, and I will go right ventricular hypertrophy. What is the meaning hypertrophy? The ventricle size are big. Hyper means big, so bigger size. Number 3, overriding of aorta. Where is aorta? Aorta should be on the left side, and overriding of aorta. What is aorta does? Supplying the blood to all part of the body. So there is problem in aorta. Number 4, pulmonary stenosis. Where is pulmonary artery? Is on the right side in the ventricle. And they may be closed, or the blood is shunting back. Are we clear? Or sometime what happened, the blood, what happened in the babies when they're not born, they have no circulation towards the lungs. When we get older, when we are born, what happened, the blood should start going towards the lungs and give oxygen and takes back oxygen. But what happened in the babies who are blue, that means the blood is not going towards the lungs, and the blood is mixed up blood, and that's why the babies are blue. And that means the connection between pulmonary artery and aorta, they are going back and forth. From pulmonary artery, from the right ventricle, the blood should go to the aorta. So these are the defects. So everyone, if you can memorize, is good. You never know what kind of questions do we have. So it's good to know there are 4 defects. Number 1 is septal defect, ventricular hypertrophy, overriding aorta, and number 4, pulmonary stenosis. I want you to write down sign and symptom of the babies are. Number 1 is the babies are blue babies, cyanotic babies. Number 2, failure to thrive. The meaning failure to thrive, they're not gaining weight. Why? Because they can't do anything. They're not getting oxygenation. And when you have lack of oxygen in your body, you cannot do. A newborn baby, they're drinking milk. And mother says in your question is, I'm feeding my baby, and baby gets tired, and baby goes to sleep, and baby is losing a lot of weight. That means they have a problem in their heart. One reason are they're not getting oxygenated, and they get tired easily. So failure to thrive, that means one sign. Number 2 are their blue babies, which I said earlier, so their babies are blue. Number 3, is they have murmur in their heart and they get tired. And very important sign is lack of oxygen or clubbing of finger. Everyone write down the first sign. What would you see in babies who are born with tetralogy of Fallot? They have clubbing of finger and they are tired. They are blue babies. How do they treat them? By giving digoxin. And so they will do surgery, but what are they giving them? Are digoxin. How do you give digoxin? Check apical pulse. And how do you give their medication? By syringe, needleless syringe or dropper. Never pick up your teaspoon. And how do you calculate the dose? We all know height and weight, but remember one more word for your calculation: body surface area. BSA for your diet and for drug, they have to calculate the body surface area. Digoxin side effect in the babies are, I want you to there, vomiting, number one, and bradycardia. In adults are different. I'm not going to talk. Somewhere else I'll have you write it down. But here, at least remember the word is, baby is vomiting and bradycardia. What is digoxin does? Lower the heart rate. That's why we need to check the apical pulse. So everyone is okay. What is tetralogy of Fallot? Congenital heart problem. What are the two main signs I want everyone to remember are clubbing of finger and failure to thrive. Digoxin question, baby vomited, do not repeat the medication. Tell the mother to give the dose next day. And you don't know how much medication has been absorbed. And when you're giving medication, you use dropper, syringe, calculation, BSA word is important as the body surface area. They have to plan to do the surgery. And why? Because these are the congenital defects. Surgery has to be done. After surgery, remember, it's a cardiac and they're newborn babies. Remember, is do not introduce any new food after surgery for some time. Why? New food cause what? Allergies. Number two, not to keep them out in the crowd because the risk of infection. And if the older child are, restrict activities for 6 to 8 weeks. Are we clear? And no dental work. Why? Because a lot of infection can go by dental. So some of your question you got to have thinking about surgery question, about giving digoxin, sign and symptom. Everyone knows is main important sign and symptom, clubbing of finger. And what happened to the babies if they had a TET spell? I want you to write down TET spell, cyanotic spell. What do you do? Number one, knee chest position. So write down there, knee chest position. Number two, what do you give them? Oxygen. How do you give oxygen? By mask, 100%. Number three, give them IV fluids. And number four, morphine for pain. Be clear and rest. 4 answers: knee chest position, oxygen, saline or IV fluids, and morphine. So what is the first sign of congenital heart disease or tetralogy of Fallot? Clubbing of finger. What is the baby is having here? Remember the word hypoxia, lack of oxygen. You are giving digoxin. Now I will move on, number 5, Maui medication. What is Maui medication are? Is a antidepressant. Highlight the word. It's a medication for depression. I want you to move on the 4th line where it says Maui used for depression, and underline the word paranate and marpolane and also Nardel. And skip where it says autonomic and go under autonomic. Easy way to remember Maui, it says the word Panama. P-A, paranate. N-A, Nardel. M-A, marpolane. What are these medication? Are Maui medication. Now there are 3 groups of drugs you're using for your medication for antidepressant, but one of them is Maui medication. And when you're giving Maui medication, very important, what do you avoid here? Tyramine, write down on the side, Tyramine. Tyramine is the food containing tyramine. And what is happened with tyramine a patient is taking? And remember, there are a lot of food you have somewhere in package in my drug. But cheese, very important. Alcohol, you do not give them any kinds of beer and alcohol and pickles. There are a lot of food you have with Pyranate. But I want at least to write down cheese, pickle, and also alcohol. Now, if they take this food, what will happen to them with tyramine? Increases their blood pressure. And they can go in hypertensive crisis. So very important, hypertensive crisis. And everyone should know, is the drug you're giving Maui. Maui are antidepressant. What are the names of 3 drugs? They may not give you in the exam the word Maui. They might give you the word patient is taking Pyranate. And you got to know Pyranate is what? Maui medication. So what is the name here? Is the word we call here is Panama. So everyone should know, do not give them the medication. Autonomic dysreflexia, we talked in the other pages, but I will repeat very simply here. What is autonomic dysreflexia is, I want those who have not heard or were not here, is write down the word complication of is spinal cord injury. Patient who has spinal cord injury, what happened to those patients are, they are paralyzed. So write down the word spinal cord injury patient. They are paralyzed. And what happened is, patients who are spinal cord injury, when they are in pain, write down the word or noxious stimulant word. That means something stimulating, some question, they have only one answer, remove noxious stimulant. So noxious stimulant means something stimulating. And what happened, remember one word, autonomic dysreflexia is hypertension. Patient's blood pressure goes up when they are in pain. And what is the reason for pain are, one answer could be noxious stimulant, or maybe you're checking their bladder and BM, that sometimes when they cannot pee or they are constipated or impacted, the pain increases their blood pressure. And what do you do on autonomic dysreflexia? It says, it's a life-threatening emergency. What would you do as a nurse? First thing, lower the blood pressure. So what do? Elevate the head of the bed. Second one, make your patient comfortable. Maybe their clothes are tight. Maybe they're wet linen. Then third thing, check for bladder. And what do you check? If they have Foley catheter, write down, check for kink. If they have no Foley catheter, then what do? Straight catheter. Next one is bowel impaction. Check for impaction. And then you will give blood pressure medication. And why? Because your blood pressure can cause a lot of problem to the patient. So before you pick up your answer, and never pick up your answer, call the doctor. Because they're asking you, what would you do as your patient is admitted with autonomic dysreflexia? First thing is raise the head of the bed. Because why? You're lowering the blood pressure. If they're saying make your patient comfortable, loosen up the clothes, dry the bed sheet, make sure you change the linen, the main thing is keep your patient comfortable. And third thing, you check the bladder. The fourth thing, you go on your bowel movement and make sure you have checked everything and you have done, and now you give medication. Now you call your RN and you document. Everyone is okay? What is autonomic dysreflexia? Everyone remember the word complication of what? Spinal cord injury. What happened to the patient here? Hypertension. What do you do? Lower first thing, blood pressure. And why does the patient has hypertension? Is because of some stimulation in lot of book, exam cram book, you will do questions, some book, they're not asking all that apply answer. They say, what is the reason? Answer is noxious stimulant. Complication of what? Spinal cord injury. What is your first response is lower the blood pressure. Are we clear? And what do you do last after you have done? Then you notify and document your patient. But everyone make sure add this word, because a lot of book when you're doing, they have no other answer, maybe one answer, remove noxious stimulation. Very important, we all are nurses, a lot of patients, their spinal cord injury, they're sitting and laying with this position and a problem. Let's take a quick break and then we'll continue.